Welcome everyone to today's webinar, The Patient Financial Experience, Before, During, and After a Pandemic. I am Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, I'm pleased to briefly introduce our terrific speakers today. We're joined by Sheila Dreyer Van Buskirk, Vice President of Lead Research and Insights for Synchrony, and Tim Donovan, Senior Vice President of Synchrony and Chief Marketing Officer of CareCredit. Tim, I'll now turn the floor over to you to start today's webinar.
Great, thanks a lot, Morgan. Hi, everyone. This is Tim Donovan. I'm going to be speaking first, and then I'm going to turn it over to Sheila, and then we will wrap it up with some time for questions at the end of the presentation. But Sheila and I are really excited to talk to you about some research we've conducted about the patient financial experience. And what we mean by that is the experience patients have in learning about the costs and paying for care along with the actual care they receive. We've really uncovered some, I think, interesting insights we want to share with you about the start, kind of like also at the start of the pandemic and also as the pandemic's unfolded. But first, just a little bit about CareCredit, that who we work for. We are the leading healthcare credit card designed to help people have a better patient financial experience and really get the care they want and need for themselves and their family members. We have about 240,000 acceptance locations across the U.S., across a wide variety of healthcare specialties. So as I mentioned, we're going to talk about the patient financial experience, a couple insights we found about the impact of costs and the decisions people make around that, what that journey is and how people are feeling about the patient journey and where cost factors into it. Some research we did about the impact of the coronavirus and the decisions people make around care, and then some ideas we have about how we can help providers addressing all the different situations when discussing the costs of care with their patients. So we'll go to the next slide, the patient financial experience. So the patient financial experience has grown more important over the last several years, really as out-of-pocket expenses for care have also risen significantly. People are increasingly concerned about what they have to pay for and the anxiety around the unknowns when it comes to what's covered by insurance, if they have it, and also what's not. And consumers are really looking at healthcare much like they do other purchases. They're doing a lot of research, reading about the types and costs of care, getting opinions from family and friends about the providers, the different procedures. And in doing so, their expectations are rising because they're parting with more of their hard-earned dollars than they used to have to before. And they really want to know what they're getting into and what they're paying for, and is there a true value exchange going on there. The consumer is now the payer. It's not just the insurance company that the providers are having to work with and also having to collect payment from. And so now this rising expectations, the change in out-of-pocket costs for consumers is posing a lot of new challenges to providers that they haven't had to deal with in the past. And so what we hope to share with you here is just some of the ways people are thinking about the cost of care and kind of how the providers can have the right kind of conversations with their patients. Because in doing that, they'll actually improve the overall patient experience if they have handled the conversation correctly. So what's interesting here is as the pandemic has unfolded over the last few months, and obviously we've read a lot of reports about the unemployment rate rising, it's left many millions of people without employer-sponsored health insurance. And this is creating a ton of anxiety for people about a whole host of issues, whether they have insurance or not. And earlier in the month, you see that over 90 million adults said they had delayed medical care because of the pandemic. Now, certainly a lot of that is probably due to their concerns about the safety or even some of the providers' offices not even being open. But we also know that in some of the research we've done, that the cost of that care, particularly for those that have had an interruption in employment and income, is a pretty big factor as well. So just think about this as we go through some of the research findings we'll be sharing in a minute. And just to give you a little bit of a background on the methodology that we went through, we did a couple different surveys with both general population consumers as well as our own care credit cardholders and care credit providers, just to see if there was a difference between those that have a dedicated healthcare payments product like care credit, as well as those that are more just general consumers. We did this a couple of different times, and amongst those that we surveyed, about the vast majority of them had health insurance, and about 3 out of 4 people had insurance through their employer. So now we'll get to the slide about the impact of cost, and this is where it starts to get pretty interesting. So as you see, the biggest factor in people making decisions about their care, there are several other factors here listed, but about 43% of the people change their behavior due to the medical costs and the procedures, the cost of those procedures. People have decided whether they're going to follow through with the full treatment protocol, and this is largely because they're concerned or anxious about the actual cost itself that they either know about or that they don't know about. And if you look at some of the other examples here, people have changed medical and dental services, they've decided not to fill prescriptions, or they haven't followed the full treatment plan. And there's a host of issues that factor into that, but the overwhelming decision about care really has to do with the cost of that care. So it can't be understated how important having the conversation with your patients about the cost of the care and how they're going to cover it and what barriers there might be to getting that care are. One of the things that we've learned a lot about is the concerns about this unexpected or surprise bill at the end. And if you see here that there is an increasing likelihood, over 25%, 28% said they would be likely to switch, 37% somewhat likely to switch providers simply because the bill was higher than expected. And also, even more so, the office staff, if they couldn't tell me the cost of the visit or the procedure before I get there, that's another factor. So again, people are being really attuned to the cost of care, and it's influencing whether or not they have the decision to stay with that provider as they move forward with the procedure. And even, as I said, they would consider switching. So more and more, the cost of care is becoming a bigger factor in how people are making decisions about their care. 65% say they'd consider switching providers after receiving an unexpectedly high bill, and 59% said they'd consider switching if the office staff couldn't tell me the cost. So there's a lot of really big factors in here around the cost of care, and I think there's a lot that we can do to try to both educate the provider about what kinds of conversations they can have, and also finding ways to educate the consumer as they're researching and looking at the different types of care they could get. So again, as part of the coronavirus research we did, we asked people what kind of behaviors they were taking into consideration as they're thinking about their healthcare, the treatment they're going to seek. And close to a little over 31% of the people said that they would be either postponing or avoiding care as a result of the pandemic. There's not a big difference between the general population and the care credit cardholders that we surveyed. The vast majority of them said that they would be doing so. The reason they would postpone care is because they want to maintain the social distance because of the coronavirus. And then also, a lot of them simply couldn't get the care because the provider's offices were closed. In many states around the country, a lot of elective care or a lot of procedures and treatments were being put on hold because they had to deal with mostly emergency care. So in many cases, the patients and consumers couldn't access the care even if they wanted to. But then even a good chunk of them, 1 out of 4 people, said that they wanted to avoid seeking care because they were concerned about out-of-pocket costs. And what's interesting here is whether it was for themselves or family members, there was no real difference between who was going to be seeking the care and who they weren't, whether it was older adults, younger adults, or even the children in the family. It was pretty much a uniform decision about that decision to postpone the care. But the one thing that's interesting to note is that there are some things that people were a little bit more or less concerned with. Certainly, if there was something urgent or they needed to get some medical equipment or an ER visit, those were things that they thought that were still important for them to continue along with. And also, if there were prescriptions or some lab work that needed to be done, those were things that people said, this is still important to me. I am going to continue along those care. But things that were a little bit more less urgent, like going to the dentist for a routine visit or routine and preventive care, certainly you don't necessarily need LASIK surgery or vision care during a pandemic. And other things that were probably nice to have but not critical, at least depending on the nature of it, physical therapy, dermatology visits, and things of that nature. So people were really making smart decisions about the kind of care they were about to receive and whether it was something they could put off for a little while or it was something that they needed to address right away in light of all that was going on in the pandemic and as the news unfolded day after day. I think the other piece of this is not just about the patients, is that the providers were feeling really concerned about how this is going to affect their practice. If you see here, there were 76% of them said they were very concerned about the financial impact. For many of you, or for many providers, there was a complete interruption of service. You had to shut your doors and only deal with more emergent care, and that's a huge loss. And it's not like you can suddenly double up on visits when your doors are back open and start to rebook. So there was a significant loss and impact to the providers with the visits that they were able to have to reschedule during the height of the pandemic. Things that you see here on the right-hand side of the page, 42% of them are offering very limited service. Many people have gone to telemedicine, doing consultations by phone. And there's a lot of people that you've read it in news reports, people trying that for the first time. A lot of people actually liked it and they think they're going to continue with it. So that's going to be a changing dynamic for the provider and the patients going forward. Curbside drop-off and pickup, I think this is something that was more attuned to veterinary care, not necessarily people, but about a quarter of people are doing that. And then, as I said, the consultations by video with telemedicine. So a lot of things that people have had to adjust their practices and adjust the way the patient and the doctors are interacting with each other as a result of the new conditions imposed upon them by the virus. And then I think the last thing, I mentioned this earlier, in April, about 1.4 million healthcare jobs disappeared. Many of them were put on furlough. There are 243,000 physician offices closed, over 500,000 dental offices closed. And then the providers that we surveyed, a good chunk of them said that they would have to lay off or furlough some of their employees. So there's tremendous pressure on the providers and what they need to do to both manage their own practice, the health of their practice and their employees, as they're also trying to care for their patients. So while a good chunk of this is around the patient journey and the patient experience, the providers obviously have been dealt a significant blow as well. And I think it's important that as we think about how they're going to emerge through this, that we think about not only just how they're going to kind of get through financially, but what kind of practices they have to do differently to address the different changes in patient expectations. And as they deal with, again, the cost of care, because a lot of people have had economic and income interruption during the pandemic. And all these things are going to be factored into having the conversations around the cost of care. So at this point, I'm going to turn it over to Sheila, who's going to talk a little bit more about the patient journey and the kind of experiences that the consumer is having during the patient journey. Sheila?
Thanks, Tim. Hi, everybody. I'm Sheila Dreyer Van Buskirk, and I lead the research team for all of Synchrony. And what you're going to see in a couple minutes is a couple of different surveys that we've done. One is about the patient journey, and it really looked at how people access healthcare. As you can see, there's 6 steps, and I know you're going to all say these aren't that groundbreaking, but what you'll see in the next few stages, or in the next few slides, are some caveats to this and how it's changed and affected different people in their various life stages. So our 6 key stages are: realize that your care is needed, and that could be anything from you have an immediate problem or you've had an ongoing problem. Then you go ahead and schedule the appointment, you check in, you see your healthcare provider, you check out, and then you receive that invoice. Pretty standard stuff. But what isn't so standard is the level of stress that people are feeling at the various stages of this. So when you realize care is needed, obviously for unplanned services, that could be really, really stressful if it's something that's an immediate need or an emergency need. But then those follow-up and routine procedures all have a level of stress associated with them, and that's really increased with the current crisis that's going on. And even at every stage, even scheduling an appointment causes some stress. It goes down a little bit with the check-in and actually seeing the provider, and then the checkout process is pretty simple for most people, but then that stress level rises pretty dramatically when they get their invoice. And a lot of that is because, as Tim alluded to before, people don't understand their insurance. So they're looking for answers to things and not getting them. So whereas you might have thought, oh, this is going to be 100% covered, I have great insurance, and then you get this big bill and it's a real cause of stress for the consumer. So 78% of our consumers that we talked to said that realizing that some form of unplanned care was needed is really, really stressful. And then 53% said receiving an invoice post-visit because they thought they weren't going to have to owe as much as they ended up owing. So that's a good stressor for them. Initial cost concerns. So we asked them, what is it that is most concerning to you about the cost? And the number one answer was the medical condition itself. But if you look at that cost of treatment and out-of-pocket costs, even for follow-up things, people just don't understand their insurance. And it's something that CareCredit is really aware of and tries to educate people and help them understand what it is that their insurance is saying, because they think they're covered and they're really not covered. So that's causing a huge stressor in the consumer population, and something that providers need to be very aware of so that they can help mitigate some of that stress. So then we asked them, well, who should give you this information? And my insurance company was number one, but that's also the number one place that they're not getting the correct information. So while they think that their insurance company should do a much better job of telling them what's covered, what's not, that doesn't always happen. And then myself. So there's a lot of people that are doing a ton of research, and part of this path to purchase was how much research they do up front, especially if it's an elective procedure. They may look at several different providers and different procedures and really research the heck out of things. So they're relying on themselves a lot. But then the staff working at the provider facility, you heard Tim talk about that a little bit earlier, almost half of the respondents said, I really expect the staff to know what my out-of-pocket is going to be and what my insurance covers, and be able to tell me how much of that cost is going to be on me versus on someone else. They're not looking to the actual doctor to tell them, but they do think that someone within that facility should be able to communicate that, and it's just not happening for them. So what's interesting about where they want the cost information, it's literally at every single stage. So the lower bar, the lighter bar is those that actually received this information, but the darker bar is the ones that wanted it. So information about out-of-pocket costs. Over 27% of them said, I want that when I make the appointment. I want to know from the provider's office that X amount is going to be on me. That would be really helpful to me. Or information on copays. It's amazing how many people are still not even clear on what their copays should and shouldn't be. And then receiving reminders, still at that point in the journey, they still want that information. So if you can give it to them multiple times, they're going to have that decreased stress, so they're already going to know what to expect, and it's not going to be such a big, huge surprise at the end. But even when they check in, again, you can see information about copays. 37% said that they expected some information about copays then. And then when they see the provider, and then when they're on their way out. So at every single stage, they want some information about what the cost of the procedures are going to be and what they should expect as far as cost goes. Balance billing is a significant source of stress for them. So they were really surprised when they got the bill. It's like over half of them said, hey, I had no idea that I was going to owe as much as I did. And then I reached out to the healthcare provider's office, not as many. Most of them referred either to the provider's office or to the insurance company itself. But then when they decided they really did owe it, it was difficult for them to find the money to pay for what they owed. And that's obviously something that we can help with. The patient surveyed said that they want help. So 35% said they expressed interest in learning about payment plans when receiving a medical bill. So if they were presented with some options for repayment at that time, that was very helpful to them. And there is some generational difference to this. So younger millennials and even older Gen Zs have a really, they are the ones that know about insurance the least. So any information that we can give them really, really helps them. So 64% of them said they wanted information on payment plans when receiving a medical bill because they need to have that comfort that they know that they have some way to pay for these services. So the impact of the coronavirus, there has been a huge impact, and what I'm going to show you next is a culmination of several research projects that we've been doing. We at Care Credit have been doing a pretty regular check-in with our consumers about how they're feeling about accessing healthcare, but we've also been talking to our providers about what it is that they need from us and what it is that they're doing to help mitigate this crisis for their patients. So consumers first, consumers surveyed expect to return to scheduling non-urgent care within the next 3 to 6 months. We've done a couple waves of this, and this seems to be holding pretty steady. But some of them have told us that they're just going to continue to postpone elective care. It's like, if I don't really need it, I'm going to put it off until I feel really safe going out into the world. And there isn't much of a difference between the general population and cardholders on this, although many more of the general population said within the next 3 months, and then it's kind of split with the cardholders between next 3 months and next 6 months. And then there's still some that are waiting to go. 14% for Gen Pop and 11% for cardholders are going to wait in 6 months or longer. And many people told us that they don't really feel comfortable going out into the world until there's a vaccine or some way to really combat this virus. So patients surveyed said providers should be taking a lot of precautions. So we asked them, what would make you feel comfortable going back into your provider's office? And some of the things that we heard were that 45% said that they would like to hear from their provider what they're doing to prevent care disruptions. They really want communications from their providers right now. A lot of the providers' offices are closed or have gone dark, but it's really important to patients, especially those consumers that are on maintenance care or things about what's happening in the doctor's world too when the offices are going to be open. There's just this big sense of the unknown right now, and any information that we can give those patients is really going to help them feel more comfortable and access care. 43% of them told us that they want to know who to call if they're impacted by the coronavirus. Should they call their general practitioner? Who should they call? What should they do? Patient surveys said they want their providers to do some things to make them feel safe. So you'll see on the right-hand side of this chart, these are all the things that they told us that would make them feel more comfortable going back into a provider's office. So clean and sanitize the office. 55% said provide employees with masks and gloves. 53% said monitor employees for signs of illness. Limit people in the waiting room. Almost half of them told us that. They didn't want to walk into a really packed waiting room. And 44% said confirmed staff tested for coronavirus. And you can see how this goes on down the way, but they were really very articulate about all the things that they would need to feel safe in a provider's office. What was interesting is when we asked our providers what they were doing, these things match up pretty well. So that's great. Provider surveys shared that they plan safety measures, and they align really well with what the consumers just told us that their expectations were. You can see, though, by those green bars that those are new protocols and how much things have changed in provider's office. So increased office cleaning, 90% said that they were doing that. Limit number of people of waiting areas, 90% said they were doing that. PPE available for staff, that's still a concern for many providers. They don't really feel like they have enough materials to be fully staffed and fully functional again. Stagger appointments to reduce patient contact, that's a new protocol, and 77% of them told us that they were doing that. And obviously, with people being shut down and that the impact to the income of the provider, having to stagger those appointments is a necessary thing, but it's also not helping their cash flow very well. Remove paper brochures and handouts. So we have gotten a big request for more digital solutions to things. And then you can see how the rest of these play out. But the providers are really taking this very seriously, and they're doing so many things to make the consumer feel much better walking back into their office. So it's a good thing that those things are lining up. While access to supplies and financial concerns, safety is still always going to be the top challenge, and also collecting payment is a concern for over a quarter of them. So they're still worried about how they're going to collect payments in this environment, especially with people losing their jobs. So they're losing their jobs, they're losing their health insurance, and is that going to affect the provider bottom line? And are there ways that that can be mitigated? And even without widespread testing, PPE, or a vaccine available, providers are looking to reopen their practices as soon as possible. So they told us that 54% of them said that they hope to be fully reopened with all types of procedures as soon as allowed. And then you can see that 23% said that they were going to limit the types of elective and non-urgent procedures initially until things calm down a little bit. And then 22% said limit the quantity of elective and non-urgent procedures initially as well. And then there was a very, very small percentage that said that they were going to stay closed until widespread testing and PPE are available, but only 1% of our providers told us that. Interestingly, dentist offices seem to be the hardest hit as far as people feeling comfortable going back into the office. Providers told us that they will also use technology to limit contact. So whereas before you might not have had those contactless payment solutions available in your office, now we're really looking at ways that you can limit the exchange of cash and things like that. So contactless payments for consumers to be able to use in their practices is something that's coming, and I think these numbers are going to only continue to go up. Also, the Care Credit app, so that our app is great. If you've gotten a chance to look at it, it actually has a digital card on it that consumers can use to access their account information so that they can pay in that way too. And then on the right-hand side of this, you'll see to see patients upon reopening, replace face-to-face with telemedicine or phone consults. I know a lot of people are using this. I actually myself used it and talked to my doctor, and it was actually really cool. And I'm like, this is great. I had her full attention, and it was a really nice way to interact with my provider. And I think as more consumers try this, it's going to be a good thing both for consumers and for providers. And then conduct pre-surgical consults remotely. Some of those things can be covered without having to be in person, and those are all coming into play much more for both providers and wanted by patients and consumers. And now I'm going to turn it back over to Tim and let him talk to you a little bit more about opportunity to help.
Thanks, Sheila. It's funny, as you were talking about the telemedicine visits, I was also reminded of my parents who are in their late 70s as they had their first telemedicine visits, just getting it set up and then going through the experience. It was the first time they had to do it, but it worked out well, and they're like, yeah, we probably will try this again. So I think it's one of those things that was slow to start, and there were a lot of hurdles to get past to make it easy to use, but it seems like it's here to stay. So interesting development. So the last part here is really for us to talk about the ways that we think that providers can help in this whole patient journey and talking about that financial experience. So as you can see, there's a lot of different ways, and there's a lot of solutions related to costs at every stage of the patient journey. So if you look at this next page, it really just shows you that at any given point in the patient journey, there are plenty of opportunities to introduce the notion of care. The notion of paying for care. Whether it's from the in-office materials, providing scripts for office staff, things to include on a website or in social media. CareCredit has a lot of ways to help you and your patients learn more about the ways to cover healthcare expenses. And we make it easy for patients to apply, pay, and manage their account in a seamless digital experience. I think Sheila talked about the mobile app that we have, and people love that ability to just sort of manage things at their own pace. You can apply through the app. But I think it's something that we have to find more and more ways to insert the cost conversation and really just find ways to make it seamless. And when the patient has applied for the product, they've been approved for the card and they pay for the procedure. The good thing is that the provider's office gets paid within 2 business days. It is a non-recourse solution, meaning that once the consumer, the cardholder, pays for the service, the obligation is no longer on the providers to collect payment. That's something that CareCredit manages. And it really comes down to it being a really great solution for both providers and patients to move forward with care. So at any stage here, we have a lot of different solutions helping to make this conversation possible. There's training and tools for the staff, and there's a lot of things we can do to make this very easy for you and your patients to get through this, what is a currently challenging situation. And I think the one thing that we've learned in this process, Sheila talked a lot about the cardholder research we've done, is that our cardholders really value their CareCredit card. 76% of them said that this is something that's super important for them to have this card, so they kind of feel prepared to pay for the unexpected or even the expected healthcare expenses that they have. As you can see from the quotes on the side, CareCredit does a lot to lessen the anxiety that people feel. They like knowing that they have something that they can fall back on if they've had to redirect emergency funds to something else. And so it's something that is very reassuring to them to know that they have a solution available when either unexpected, medical costs or, medical concerns come up, or something that they've been planning for a while. CareCredit is a way to help lessen that anxiety in the process. We're also doing a lot during the pandemic. We've done, as Sheila mentioned, research with our providers to really understand how can we help them get back to delivering the care? How do we help them get back to care? And so we looked at a revitalization program for our practices to really help them with getting the care rescheduled for their patients. And we did a lot of different things. We looked at doing promotional, like, cost incentives to our cardholders, things for the providers themselves to kind of lessen their expenses. We provided them with templates to use for emails or social media posts to really help people, let them know that they're open again, let them know that if they're having challenges with the cost of care, that those practices accept CareCredit, and they can help them with with promotional financing that helps fit the budget of their patients. Just in trying to do anything and everything we can to make sure that the practice feels equipped and ready to get back into the business of delivering the care to their patients, which is, obviously very important. So I guess in summary, the thing that's really important to say is that CareCredit is a good solution for both patients and the providers. It's something for the patients. They can feel reassured about moving forward with the care without having to worry about the cost, because they found a way to pay over time with payments that meet their budget. We have several different financing options available, and from what you've seen in what both Sheila and I have talked about, having people more reassured about the cost of care can lessen their anxiety and can lead to an overall improved financial and patient experience. And the good thing is that we feel really confident saying that CareCredit is a good solution because in an annual survey we do with our cardholders, 95% of them say they would recommend CareCredit to a friend. That's a pretty solid testimony, and I think it speaks to the importance of the card and the value that it delivers to our cardholders. And then on the provider side, obviously this does a lot to improve the cash flow of a provider because they get paid within 2 business days. As I mentioned earlier, it is a non-recourse solution, so once the cardholder pays for the treatment, pays for their outstanding bill or upfront, they get paid in 2 business days, and then the onus of collecting payment is really ours. They are paying back us on their credit card bill. So what it should do is save on a lot of administrative time and billing for the office staff to have to manage. They no longer have to be in the business of pestering the patients to pay them back. It's really they can focus on delivering the care, scheduling the care, and making sure that the office is running smoothly. The billing and the collections is really falling to us and that's really important. And in the survey that we continue to do with our providers, every year we ask them about the value of care credit. 30% of them said that care credit actually increased their practice revenue because they have an ability to move, for their patients to move forward with the care they're recommending. And 47% of those surveyed said the care credit helped them get paid faster. As I mentioned, the 2 business days payment is a really strong point for people that accept care credit. So all in all, we think that there's a lot of opportunity for care credit and for providers to improve the conversation of care and the cost of care because they'll know that they have a solution to offer their patients, and also that the patients will feel more confident about moving forward with that care because they feel reassured, they feel less anxiety about knowing that cost could potentially be a barrier to that care. So we're really excited about the opportunities that we have for our providers and helping them get back to delivering the care they want for their patients. And hopefully, once things get a little bit back to normal after the pandemic subsides, the patients and providers will feel good about moving forward with care. So I think at this point, we are ready for some questions if you've got any, Morgan. And Sheila and I will be ready to take them.
Absolutely. Thank you, Tim and Sheila, for that fantastic presentation. Like Tim said, we'll now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box that you see on your dashboard. We're going to try to get through as many questions as we have time for today. And the first question that has come through is about your research and specifically, what is the sample size of the patient research, and do the results differ regionally and socioeconomically?
Sheila, you want to take that one?
I can take that one. So we've done several waves of this. We did a couple of waves with our cardholders, and each of those had 1,100 was the first sample size number, and the other one had about 1,400 respondents, so pretty good sample sizes. And then when we went out to the general public, we asked that question again, and we got over 2,500 responses to that. So pretty big sample sizes. And tell me what the second part of that question again was.
Regional differences.
Yeah. So there weren't any real regional differences. That return to care was a little bit higher in areas that weren't hotspots, so that kind of middle of the country saw a little bit, but it was like only 2 or 3 points higher, so we didn't think it was statistically significant to call it out that way. There was a generational difference a little bit. I called it out earlier too, that millennials are the ones that are most impacted, and there's a couple reasons for that, especially younger millennials and Gen Zs. They're in those jobs that were quickly furloughed. They're in the startup jobs, so things like you're a waitress or you're a hostess, and if your restaurant shuts down, then you've been furloughed and you no longer have a job. So that is what we're attributing that generational influence being a little bit higher for those populations that were directly hit by the coronavirus shutdowns.
Got it. That's a great question, and thanks for breaking down those different parts of it as well. We have another audience member who is curious about what types of services that care credit can be used for. So they're wondering, can care credit be used for any medical, dental, or vision services, including those that may be deemed elective or cosmetic, or is it just limited to required standard care?
No, actually, that's a great question. One of our biggest practices is actually in the dental field. So the overwhelming majority of dentists accept care credit. We have providers in dentistry, veterinary, vision, audiology, cosmetic, dermatology, and many, many other specialties. So it is a card that is accepted across a wide spectrum of healthcare specialties. As I said, we have 240,000 acceptance locations across the country. The card can also be used for pharmacy purchases at Walgreens, Rite Aid, and Sam's Club and Walmart in their pharmacy and personal care department. So it really is something that can be used for elective care as well as routine care at any of those areas, or as I say, prescription and personal care items.
Got it. And just a reminder to audience members, please keep submitting questions. We have a lot of great ones coming in. Next question is about discussing financial matters with patients. So if staff members aren't comfortable talking about financial matters or see it as not part of their job, this audience member is curious, is it reasonable to ask them to go over costs and payments with patients?
Sure, I'll take that. Yes, I mean, if you saw both in what Sheila presented and what I presented, the financial consideration has a huge impact on their decision to move forward with care. And patients really want this information. I think if you saw just the sort of states of anxiety in the patient journey, you see that there were a lot of opportunities there to introduce the conversation about what types of care is going to be given, and then also maybe even some of the costs associated with that. So I think that it's something that is increasingly a necessary part of the job. It's changed over the years, obviously, because as high deductible health plans and out-of-pocket expenses have gone up, that onus of having to discuss cost is much greater, and it is on the part of both the provider or the office manager and the patient. So I think it's one of those things that it has to be something that providers and office staff are taught, and they learn and then they practice it. And hopefully over time, as they do it more frequently, it becomes an easier part of the conversation, because I think it's just something that patients and consumers are expecting to know. What am I getting into? What are the costs I have to consider in order to move forward with care? And knowing that there are solutions available to them will reduce or lessen the anxiety they feel about it, and knowing that there are things like a care credit card for financing it over time if it's a big ticket item, like a lot of elective care is not covered by insurance. If they can find a way to pay for that over time in a way that fits their budget, I think that's something that it's just going to be one of those things that has to be part of the conversation between the provider and the patient.
And if I can add to that too, consumers are doing that, that they look for financing information on the website too. So when they're doing their research to try to figure out which provider that they're going to go see or what their provider offers, they're looking for that information even on the website. So it's really important for providers to have that information available to the patients even before they become patients in some cases.
Yep, good point.
Absolutely, and the more often these conversations will be had, the more used to it patients and providers will become. Absolutely. We have another question about looking beyond the survey results that you guys have found. An audience member is curious, outside of the survey results, are you seeing stronger or sustained interest in financing to help with medical bills?
Definitely our consumers are telling us across the board that they're looking for help, not just in the healthcare space, but in all spaces. As this crisis continues to roll out and people's jobs are so in flux, it's really helpful for them to have a way to pay for goods and services. So we've heard a lot about how you saw 95% of the cardholders saying that they'd recommend Care Credit to a friend. People have a relationship with this card, and I know it sounds crazy, and people always say, yeah, that can't be true. But it actually is true. Our cardholders are really good advocates for us, and they see us as a way to give them that security blanket of being able to pay for things no matter what life throws at them. So I think even beyond the survey results, I've been doing this for 15 years for Care Credit. So I have heard patients over and over and over again tell us how important this is to them. So I would say yes, that financing is more important than ever for most consumers.
Yeah, and just to build on that, I think it's just a natural extension of the way healthcare is unfolding and the costs of care are unfolding, whether it's deductibles are going up, premiums are going up, what's covered, what's not covered. I think people are looking for ways to cover the cost of medical care more so than they ever had to in the past. If you had insurance years ago, you had a copay, or you might have had a slight co-insurance payment, but it wasn't hundreds of dollars or thousands of dollars in the case of like a high deductible plan for a family. Now, I think the average cost is about $1,200 of a deductible for an individual for a high deductible health care plan. And that's only more if you have a family of 3 or 4 or whatever it is. So the out-of-pocket costs are considerable, and people are looking for solutions beyond their traditional means, whether it's savings or another credit card or something. So to Sheila's point, something that is a dedicated solution for healthcare payments and financing over the course of a year and then some is really, I think, taking on heightened importance more so than it did in the past.
Right, those observations are really helpful. Beyond the survey results and testimonials reveal a lot about patients' wants and needs right now. We have another audience member who is curious about who bears the cost if the patient doesn't pay their credit card, their care credit card. Is that what non-recourse means?
Yes, that's exactly what it means. So recourse means it reverts to the provider, but a non-recourse solution like a care credit card means that the consumer, the patient, makes the payments, whether it's upfront or as a post-care bill, and then that payment now becomes part of their obligation as a credit card transaction. So non-recourse means that the provider no longer has to be responsible for any follow-up billing, assuming that the patient has paid the outstanding balance in full, and then they become like a cardholder and a customer of ours to help manage. They're still the patient of the provider, but then all the outstanding payments are now the responsibility of Care Credit to manage with the cardholder.
Thanks for that explanation, Tim. We have another question about sort of what do these conversations look like between patients and healthcare professionals. An audience member is curious that if doctors and healthcare professionals are already strained for time with patients, how can they fit in additional time to discuss financial aspects of care?
I think it really comes down to making it a priority and integrating it into the process. As I said, it's something that's it's sort of arrived at everyone's doorstep, and I don't think it's going away anytime soon. So both the office managers and the providers have to think of this as part of their normal routine. The financial considerations are a major aspect of healthcare decisions for so many patients, and they want and need this to be part of their overall journey. They need the support from the providers more than ever. And so to some of what Sheila mentioned earlier, beyond just having the direct conversation, whether it's by phone or in person, there's so many other things that people do to find out information about the care, the provider, the different options. And they can put this on if the providers have a website or social media or in the waiting room if there's signage, if you do appointment reminders via text messages and things like that. There are many ways to introduce the whole notion of, want to find out or have a conversation about what you owe, or, don't forget to think about, a product like a Care Credit if you want to be able to pay for your health care, if you have or anticipate that it's going to be an expensive procedure. So I think it's one of these things that it just is a necessary part of the overall care process and the patient journey and the provider journey in that process. So, I think it's just really, it's about making it a priority and integrating it to the routine. And as I said earlier, the more you do it, the more comfortable you feel and the easier those conversations get, because you understand the dynamic involved. And one of the things that we do quite well is we provide a lot of scripting tips on how to have those conversations, a lot of materials to guide the conversation, both as the staff in the office and also with the patients, so that they understand what they're getting into when they when they sign up for Care Credit. So there's tons of collateral. We have a website, obviously, carecredit.com, that people can go visit and learn more about it. So there's a lot of different options for people to have this kind of conversation.
Great, just tons of insight from our presenters today. And it looks like we have time for one more question, and it's related to COVID-19. An audience member is curious if you're seeing any other trends emerging or changing in light of the pandemic, especially as the situation continues to evolve.
Yes, we're doing biweekly pulses with our consumers to really see how their habits are changing and how they're thinking about things are changing. So I would say that there's many, many, many things that are changing. The telemedicine was one of them as far as healthcare goes, but also how they're researching. People have a lot more time on their hands now, so they're spending a lot of time researching things. So a presence everywhere you can possibly be is a good thing. So even on Facebook, people are looking towards social media influences to find their providers and to research procedures and even get testimonials. So I would say that this pandemic is altering the way that people behave in ways that we're just beginning to understand and see. We're really trying to stay on top of it by doing those biweekly pulses, so we will be able to relay that information to our partners and help them mitigate everything that's going on in the world. But the answer is yes, everything's changing, and the list is long. But we're here to help.
Absolutely. And before we wrap up today, I want to give Tim and Sheila just one more moment. If you have any final thoughts to share on our topic today, please do so right now.
Yeah, I mean, first of all, thanks everyone for tuning in to Sheila and to me as we talk about all the challenges facing both providers and consumers. There's a lot to go on right now, and there's a lot to think about, both once, as we're in the midst of the pandemic, and then once we sort of emerge and things start to return to whatever normal is. I think there's a lot of things that are forcing change and innovation within the healthcare industry in the way people think about receiving care, delivering care, paying for care. And so I think what I'd love to just say is that as Care Credit, we are really looking at all these same trends and looking at all the different ways that we can help both the patients and providers be ready. And when they're ready to both deliver the care or get back to seeking care, we are ready to help. And we have a lot of solutions in place to help people as they want to move forward. So thank you very much for your time, for your interest in what we had to say. And hopefully you learned a lot. And for those of you that are looking at Care Credit as a solution, we'd love to work with you.
I just want to give one more thanks out to Tim and Sheila for their excellent presentation today, and for Care Credit for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.